that. A lot of them are from CDC. There is variance in caseload throughout all of the nation. So maybe in California right now, Mississippi, other places, Georgia, things like that, a lot of those places have a lot of cases, but other places may not have a lot. So the way you treat those situations have to be a little bit different. And then there's also this big thing, and it's kind of a touchy subject. And I encourage everyone to approach this very carefully. There's a discrepancy between what guidelines are and what we actually do in practice. And I'll get into that once we hit the guidelines section.
Sorry, real quick. Am I presenting already?
Yeah.
Sorry about that.
Okay.
You didn't give me a heads up.
Oh, sorry, Tony. Yeah, so we're on slide 4 now, but go ahead and cover that slide 3. You guys will see that objectives, and then slide 4. Yep, go to the next one. Okay, those are the objectives, and then the slide right before that is the disclaimers. There we go. Okay, and then know that this is not professional advice. Okay, this is not to be taken as legal health advice or anything like that, but it's just I am using some of the professional knowledge I have in order to inform you of this, but please do not take this as your doctor's recommendation or your lawyer's recommendation or anything. Okay, so let's go ahead and jump straight into the first section about SARS-CoV-2, just a general overview of it. So as we know, the transmission, you guys see, it's mostly done by respiratory droplets, right? You see there's a lot of the next slide, Tony, close contact or with surfaces or objects. This is pretty straightforward. And the next one you see, I made a chart or a table so you can kind of identify what practices you need to do. So let's take a look. The first method, and we'll go column by column, okay? The first column is person to person, right? So when does it transmit from person to person? Whenever something comes out of your mouth or your nose, by breathing, talking, singing, coughing, and sneezing. Those are the main ways, right? Now, if it comes out of your mouth or nose like that, how do you stop it at the source? You have to cover your mouth or your nose, which is masking. Stay on that slide. There we go. Okay. And then this next one is, how do I protect myself, right? So if you're transmitting from person to person, it's coming out of your mouth and your nose, you're stopping at the source by having that mask. But then let's say it already spread out. So how do you protect yourself if you are one of those other people? Then that means you have to have social distancing, standing far apart. I don't like the term social distancing, even though that's a technical word. I like to call it physical distancing because technically you're physically distancing yourself, but you can still be socializing with each other. Okay, so that's one way. The other way, as you see in the third column there, is surface. So if, let's say, someone talking, saying, or whatever, the droplets fell onto your phone or a countertop or a doorknob, then you touch it and then you touch your face, that's a problem, right? That's how it transmits. So that's more kind of like a secondary level of transmission. And how do you stop it at the source? If you accidentally touch it, then you don't want that item or like that doorknob to be dirty, so you got to clean and disinfect it, right? Stop it at the source of the doorknob. Now, how do you protect yourself from it? Oops, I already touched the doorknob, it's dirty, my hands are dirty, I gotta wash my hands with soap and water 20 seconds, or with hand sanitizer with at least 60% alcohol, okay? So this chart is kind of the main thing that you guys need to focus on in terms of the basics here. So that little poll that we saw here, and what is the main route of transmission of the virus, it is actually what we believe right now, based on the data that we do have. It can be revised later on with new information, but with the evidence that we do have right now, it does show that it's person to person. Okay, so as you see in this next slide here, that person to person, when we talk about airborne transmission, air transmission, most of what it is respiratory droplets, those red arrows, those big red circles there. And they do see the international studies collectively, the evidence shows that 3 feet is the most common. 1 meter is the most common way that it spreads. There are some droplets that do send out further to 6 feet, in especially depending on how much air can pick up, or like air conditioning situations, it can kind of blow the droplets a little bit further. But once these droplets, they get into the air, some of them will have dissipated, right? A lot of the liquid around it will dissipate. And so now the virus particle that's trapped in there, it's going to be in a smaller particle. Those are the blue things that you see there, right? So that is what they call the airborne transmission. You don't need to worry too much about this, but this is where that 6 foot rule comes from. If you go out of the US, you hear about the 1 meter rule, right? So there's not really a like a magical number where if you're exactly 6 feet apart, you're going to be okay. No, not necessarily. It's just a kind of a guideline for us to kind of estimate and be aware of how the virus spreads. All right. So let's take a look at infection risk. You can understand how transmission works and everything, but at the end of the day, the main things we want to understand is you as an individual, how is your risk increased? Two things, distance and duration. So the more closely you are interacting with somebody, the closer you are, the higher the chance of you getting infected or infecting someone else. In the same way, the duration, the longer you guys are working together, interacting with each other, the higher the chance. So obviously, how do we prevent that? Stay as far apart as you can and limit the amount of time that you interact. So that's on the individual level. But now let's take on a group level or environmental level. The main factor that contributes to it is ventilation, which means in an enclosed area, you have like your breathing and all that, all these particles are floating around, right? So there's a huge concentration of viruses. But once you have outside air come in, it's flowing through, then the concentration of the particles, it spreads out. Right? So there's less of a chance of you accidentally inhaling one of those viral particles. So ventilation really just means increasing the outdoor air, moving into your indoor area. It helps reduce that concentration. So those are right here, you guys see, are the key principles. Distance and duration, try to increase the distance and decrease the duration, and also increase ventilation. Those are the biggest ways whenever you're gathered in an area with other people in order to decrease the risk of you having the virus. But at the end of the day, what do we want to do? Because we don't know if you're sick or not. Like, let's say if you're not sick, you may transmit the virus. If you are sick, you may not have COVID, you may have it. You know, we're also unsure. So the key assumption we have to think is everyone is infected and contagious, even if you don't have symptoms. So you guys hear a lot at the beginning, you know, hồi đó mà có một người mà bị COVID ở trong một cái tiệm nào, like I think in San Jose, one of my aunts texted us out. They said, oh, Lion Market had to close because of somebody there, a supermarket worker had COVID, right? And mọi chỗ phải đóng cửa rồi, and everything like that. And it's like, well, that was early on, right? But now we understand just because someone has an infection doesn't mean you need to shut down everything. Why? Because we're already assuming everyone is infected. So you've got to go about your daily routines, but you just assume because everyone is infected, by having these masks, by standing far apart, by having ventilation, we're going to create a much safer environment. Okay? Any questions about that so far? Okay, so that covers that first section. And if you have a question about that, just go ahead and post it in here, or Tony, if you can send that link to them on the chat. There's a Google form that you guys can fill out, and he can take a look at it, and then we will answer the questions from there. You want to submit it anonymously. Okay. All right, so we finished that first part, a review of the virus. So let's go into what the public health response is, right? How did we...
Sorry, real quick, Charles. I didn't get a link with that email.
No, the Unhugh's form that he that we send out to everyone.
Oh, okay, cool.
Yeah. Okay. So this next slide here, you see the public health response. We're going to dive into some of the guidelines, okay? And when you look at the guidelines, there's going to be a lot of different ones. You have from the international level all the way down to the local level. And on the international level, you have the World Health Organization. The national level, you have the CDC. Next slide, Tony. And then the state level, you have your State Department of Health or Department of Public Health. It could be called either one, depending on the state that you're in. Next one, Tony. And your local level, you have your county department. So here I've linked to you guys the WHO, the CDC, and then the California one is here. And then your local one is typically a county, not a state, because states usually aren't equipped with a public health agency. That's usually administered at the county level. And then last but not least, you have your specific diocese. Each parish usually doesn't come up with their own set of guidelines. It's ecclesiastical, I don't know, I'm butchering that word, diocese. They run by, provinces and dioceses, right? The church runs by provinces and dioceses. And so at the diocese level or your bishop level, they are the ones that decide how things are going to work. They usually have an Office of Youth and Young Adult Ministry. That's the main one that you should look out for. Obviously, you want to be aware of when mask is allowed or not allowed, but that's not your main concern, right? We as huynh trưởng, we are more focused on our sinh hoạt. Nếu mà có thánh lễ là cái đó tùy các cha, right? Your cha chánh xứ, your cha tu ni, that's their responsibility to inform you about what the rules are. But your focus would be more on the youth and young adult ministry side. So let's see. I would encourage you guys. We can click on these links later, but one of the ones that I want to actually point out, Tony, if you can give them that link in the California Department of Health right now. So everyone go ahead and open that one up. Let me see if I can post it. Here we go. Let me post that here. Go ahead and try it out for yourselves right now. Go ahead and look at that website. This is the California State Department of Health, Public Health. And you see at the very beginning, you'll see that it has COVID-19, right? This is the link directly to COVID-19. If you scroll down, you see that there have been 3 orders under the section called alerts. Let me see if I can try sharing that on my screen. Here we go. Can you guys all see that right now? Right, okay, so here are the alerts, right? There's, at first on March 20th, there's a stay at home except for essential needs. And then there's a state public health officer's order on May 7th, and then on July 13th. So the one that's most important right now is the July 13th one. So a lot of websites will have a lot of different updates on there. You do need to follow the most recent one. A lot of times this order will reference something older. For example, to say, you still need to honor whatever provisions are stated in the March 20th one. So the July 13th one will say that specifically. For example, in California right now, this order from July 13th does say that March 20th, we said, stay at home as much as you can. July 13th order says we still affirm that. However, we now allow this thing or that thing to open. That's essentially what it is, okay? Let me go ahead and go back here so Tony can share the screen. Okay, so back to the PowerPoint here. This next slide, as you guys will see, if you take all the guidelines, a lot of things can be kind of confusing, right? What am I supposed to follow? March 7th or July 13th, or what is it? At the end of the day, let's just think of it in this way. 4 things to remember for individuals. First of all, stay at home as much as you can. If you cannot stay home, then try to limit any activities that you do to what you call essential activities, the things that you need to really survive. Now, if you cannot limit to just that, right? If you do have to go outside to do other stuff, try your best to avoid crowds, crowded places, other people. If you cannot avoid crowds, then wear a mask. So that's more, this is kind of a grading, right? If you can achieve goal number 1 of staying home, awesome. If you cannot, go to goal 2, goal 3, then goal 4, okay? So at the end of the day, mask is important, but that is actually kind of the last line of defense that we have as an individual. Okay, so now the next one is recommendations for groups. So now we know individuals, right? But let's take a look at what we need to do as a group, especially trong các đoàn của mình. So the next slide you see says, first of all, if you have activities, we want to cancel it, right? Can you cancel the activity? If you cannot, let's see if we can change it to a virtual platform like Microsoft Teams. If you cannot do that, like let's say, for example, some things that do need to be done in person to have that interaction, right? You need to move it outdoors. If you can't move it outdoors, it has to be indoors, then try to take precautionary measures, such as increasing the distance. People have to stand 6 feet apart or things like that. So we can dive into the precautionary measures later as well. But this is essentially what the public has decided. This is what we need to do for individuals and for groups to help reduce the chance of transmission. So just think of it simply in that manner. Those 4 things for individuals and these 4 tasks that you should do for groups. Keep it simple. Don't get too riled up in exactly what the guidelines are specifically saying, at least to help you understand, okay? So now that you have these things in mind, let's go ahead and take a look at how do we evaluate each of these situations and how do we make a decision at that point, okay? So the first thing is, in a đoàn, right? You are now leading the đoàn. So you don't have that responsibility just as an individual. You also have to các em, các phụ huynh who mà nếu mà các em đi á, mà lây lẫn mình á, các em có thể lây đến ba mẹ của nó, right? So you don't want that to spread or to the grandparents. So we have to understand, what do the guidelines say? Why is this important? Because even if, let's say, the guidelines state that, and this is a clear example right now in San Jose, the guidelines for California do say that indoor gatherings can only have up to 100 people. And they say that all religious services in counties that are on the watch list are not allowed to happen unless they're outdoors. And if they are outdoors, they have a max of 60 people. That's what the county says, right? 60 people outdoors, no indoor services allowed. Now, the third thing is that the diocese says that if you have an outdoor mass, those are the only things that are allowed. Public masses can be done outdoors, maximum of 25 people, according to June 5th, the proclamation from Bishop Soto. So you see here, California State does allow indoors for certain counties. Santa Clara County specifically allows up to 60 people outdoors. The diocese allows up to 25 people for mass. So what exactly are you supposed to do? You're supposed to follow the strictest requirement, which is 25. Now, number two, what does my pastor say? But my pastor said we can do 60. Okay, nếu mà cha chánh xứ nói, hoặc là cha nói, we're going to have mass, we're going to have up to 60 people, then cha can do that, right? But you as a Huinjun, if you run an event, first of all, if cha says that you are allowed to go ahead and sinhua outdoors, does the diocese allow for sinhua yet or not? Right now, the diocese doesn't state anything specifically about that, yes or no, but it does say regarding mass. So if you participate, if you hold a mass yourself, right, you're going to take the risk of, if someone does get sick and my mass had over 25 people, what's going to happen? If someone gets sick and then they decide to sue me, and they sue my church, and they sue my diocese because of that, because we could have prevented that, that becomes a problem. It's very, very, very unlikely that someone will do that. However, it's not a matter of if it's going to happen, it's a matter of when. Okay, so it is this decision-making balancing act that you have to do. Cha thường nếu mà các cha nói có được 60 người tham dự thánh lễ, okay, then that's up to him to go ahead and decide. But if you are going to host an event and you host an event that has 60 people, is that okay or not? That's up to you to work with your pastor and decide, right? Are you willing to take that risk? Because at the end of the day, the diocese will not back us up if we run an event under the diocese as a don, because as a don, you're under the parish, which is under the diocese. So if you run an event that has over 25 people, most likely the diocese will not back you up, and anything that you have to pay out of a lawsuit comes out of your pocket or your don's pocket or whatever that is, but not out of the diocese, right? So that's one thing to keep in mind. However, if you think that that risk is something you're willing to take because the parents are demanding it, that's something we cannot advise you to do or not to do. But it is important to know what the legal guidelines are, because the guidelines, whether it's state, county, or diocesan, that is written there, and they have attorneys that vetted all of this, so that in the court of law, whatever defends you is only up to the scope of the guidelines, okay? I know that's a lot of kind of big terminology. Hopefully you guys understood that, but that's why it's really important to know what the guidelines are. But now along the practical side, how do you evaluate an activity? So just those 4 questions, right? Is it essential or necessary? Can we do this virtually? Can we do it outdoors? And if we cannot, can we modify it so that we can increase that distance or decrease that duration of time that we're there? Okay, just ask yourself those 4 things for any kind of activity that you need to do, whether it's a retreat, whether it's học hội đồng huynh trưởng, tông đồ nội trưởng training, một cái sinh hoạt bình thường thôi, right? It doesn't matter what it is. Just go through those 4 steps. Okay, any questions about these? Okay, vậy bây giờ mình tiếp theo. Cái phần kế tiếp là virtual operations and programming. So we know at the end of the day, there's always going to be cases that will rise and cases that will fall. So when cases rise, you want to scale back your operations. But when cases fall, you want to be able to do more in-person things. But if you do more in-person things, then more cases happen, right? So there's this big giant flip-flop back and forth that's happening all the time. So what the heck do we do? At the end of the day, because we know that infections are going to rise at some point, you want to have a backup plan. And that backup plan should be virtual programming, virtual ways to do things, right? So always have some kind of backup thing, and then you add on to that. From the virtual, you add on the hybrid stuff, which is once in a while you may meet up in small groups or things like that, okay? when you plan the curriculum, you want to assess 3 different things. You want to go through the 3 different things. You want to assess the priorities, which is look at what the needs are. Các em cần những gì và các em muốn làm những gì. Right? Các em tụi nó đi học mỗi ngày rồi. They go to school every single day and they have Zoom meetings and they really dislike it. Right? They're always online. So maybe they don't want to learn online. Maybe that's something they don't want. But maybe you think that their faith formation is really important. So how do you present that in a way? Like what you got to fine tune that balance. You know, is their unwillingness to join an online meeting greater than their desire to, you know, bond with the church and bond with các anh chị huynh trưởng, right? You got to debate what your specific đoàn needs in terms of priorities, and also các phụ huynh. For example, we have in San Jose, there's a lot of đoàn that will still do virtual programming. However, in Hawaii, it's largely tourist-based, right? So a lot of parents work in the tourist industry or restaurants. They're really hard hit. And so their main focus is really just the sacraments and just getting by financially. So the priorities are not there for Đoàn Sinh Hoạt, right? But in other areas that may not have that financial issue as much, then maybe the priorities are for learning more. So that's the case in which you should prioritize more of the academic aspect. Develop the goals from there, right? What exactly do you want to achieve? You don't have to do Jing Sinh Hoạt, Jing Thăng Tiến like every other year. Like all bets are off, okay? Let's not try to stick to, you know, these hard lines. Oh, we need to do weekly gospel lesson each week and học về thánh thể and học, you know, nghiêm tập chuyên môn. Like that's not relevant right now, right? We want to focus on what our kids really need. And then from there, you create a schedule. James went over this really well in the morning. You guys can review his workshop for more details on that. So I'm not going to focus on this. I want to jump into the risk management part of it, okay? So liability is a big thing we don't want to talk about, but we want to make sure that we always follow these guidelines set out by the USCCB and the diocese. So on this next slide, you see safe environment is still in play, okay? Even if you have huynh trưởng that are doing things virtually, you need to make sure they get their background check done once per lifetime in each diocese that they go to. If they move into different dioceses, they need to get the fingerprinting done for that diocese. Second thing is that youth safety online course. It can be called Virtues or Protecting God's Children or whatever it is, right? But the diocese does have an office for safe environment. Go there, make sure that that is done. Typically, it's about every 2 to 3 years, depending on the diocese. That must be renewed. Make sure your Đoàn Phó Quản trị has that on file. And then the next thing I think a lot of Đoàn do forget is the voluntary participation forms. Even though this is virtual, you still need this. So I'm going to go over these 3 things here. First is the code of conduct. This mainly applies to các trưởng, but also các em. What does this mean? Nếu mà các trưởng mà go online, you have to explain to them what they are allowed to do and what they're not allowed to do online. What they're allowed to say, what they're allowed to share, and what they're not allowed to. If you take the steps to do this, you will avoid having huynh trưởng posting inappropriate material, but not out of intention, but out of accident, right? But also, let's say, for example, I say something, I'm a huynh trưởng Unadon, and I say something on there, and then one of the kids will like, they interpret that as being mean or as being, you know, condescending, or they interpret it as against the church, right? Then they complain to the parents, and the parents start complaining, et cetera, et cetera. If they do say something, and then we can fall back to the code of conduct. We said, oh, well, this huynh trưởng violated the code of conduct, so that's his fault. It's not the Don's fault, right? You can say, okay, that person is an isolated situation. We will go ahead and take disciplinary measures on that person. But it's not like we as the Don condone that action. So having code of conduct protects the Don from making sure that we are following the right. We have a set of protocols, a set of standards that we expect our huynh trưởng to follow. At the same time, you do want some kind of code of conduct. It doesn't have to be too formal. It can kind of be just a statement to các em and say, hey guys, when you guys log on, make sure you guys turn on your video cameras and make sure you mute your buttons. And then if you do chat in the chat, please don't say, don't cuss on the chat, right? Things like that. Because a lot of kids, especially teens, right, they're gonna type in stuff and then, you know, they're gonna say, well, you never told me I couldn't say that, right? You're gonna always have those problems. So you have some kind of warning ahead of time. It really helps prevent those issues. So that's just in terms of the content. Now, the next thing is informed consent. At the beginning of the year, you're gonna need to register everyone, and you need to make sure you tell the parents about what exactly you're doing. What is the activity? what is it about, how often it is, who's going to be running it, etc. And then in there it says this is the activity, these are the risks of the activity, the inherent risks of the activity. And I, as a parent, when I sign this, I consent to having my child participate in this activity despite the risks. Okay, so that's what informed consent means, that I, as a parent, allow my child, even though I have been informed of how dangerous this activity may be, such as being online and, you know, people might hack or things like that. The other aspect of liability is a waiver or release. So just because I, as a parent, I know what's going on, I know that if my child is on there, someone might look into it, or, you know, there might be online bullying or whatever there is, right? Just because I know and I let my child participate doesn't mean that when push comes to shove, I'm going to say, hey, I'm okay, I'm not going to do anything. No, if I'm an angry parent, my child got hurt, I'm going to do something about it, right? I'm going to try to get someone to pay for the damages. So the waiver or release helps protect you against that. So a waiver basically means that the parent has a right to be able to lay claims against somebody for negligence. And if that's the case, if they're waiving the right, they're saying that because I participate, I let my child participate in this, I know that I'm responsible for whatever happens, not the dog. A release is kind of the same thing. I won't get into the details of it, but you can either have a waiver or release depending on your diocese. Make sure that you check with the forms that they do have at the diocesan level, and you model your form after that. I know the Diocese of San Jose and Diocese of Hawaii that I've most recently spoken with, they do have the forms already available for you to modify, and you can just edit that. Other dioceses, go ahead and check in with their Office of Youth and Young Adult Ministry. Okay, so remember, code of conduct is for how people behave. That's just the standards. The informed consent is necessary in your form to tell parents of what's going on in terms of risk, and then a section where they sign a waiver or release of their rights or their intent to sue. Okay, I know this sucks to talk about that, but it's something that we do have to talk about. Okay. Next thing is, now that we understand the theory of it, what is the actual paperwork? So you as the organizer or your Don, Banjapan, in the activity, you have to say, we are Don, whatever it is, from Yao Su, you know, whichever Yao Su it is, from whichever diocese. Yao Phật nào đó, right? Ba cái điều đó là who? Đoàn, Yao Su và Yao Phật. Now what? You have to explain your activities. We will have weekly online sinh hoạt, and we will have monthly adoration or monthly online retreat, something like that. Okay, list that out in that form. When will you have that? You need to say, you know, it's going to be on Sundays at 1 p.m. to 3 p.m. or whatever. Okay, and the monthly things, it's going to be every Friday adoration from 7 to 8. So if you list it out, then you specify the what and the when, and the where is which platform, which is you say we're going to use Microsoft Teams, or we're going to use Zoom for this, or we're going to use Facebook Live, or we're going to be using YouTube. You state those, right? And you can always say including but not limited to. That allows you to change a platform if needed, but also listing the how. How will that be done, which means how will it be communicated? So you say, we will send a mass text out every Friday to remind about Sinh Hoạt. And the text will be done through Remind or through GroupMe or whatever that is. You state the method of communication, how you're communicating it. That way, if any changes do need to be done, like you need to cancel it or you need to shift the time a little bit, then it's covered in that form. Okay, so this is for the recurring things that happen in your dog. The activity stuff that you need to include, the who, what, when, where, and how, is for what you need to include for recurring activities throughout the year. The second component that should be included in the paperwork is about the media. Every activity online, you will have some kind of data collected. You have some photos collected and videos like recordings maybe collected, and you may use them for your own Dawn advertisement or, you know, like doing a newsletter or whatever it is that you need to do to save for a yearbook, right? You will save them and use them in an official capacity as Dawn. You want the right to be able to do that. So you want to inform parents of that, and they will sign a form saying, yes, I agree to have my child participate and that you may use my child's photos and videos for formal purposes only. Okay, so that's what you must include. Then the parent and guardian will sign out and fill out all the information regarding their participant, their child, their information for contact. They consent and waive the activity, and they consent and waive the use of media. Okay, those are the main things that you need to make sure you cover. So let's go ahead. I'm going to look over here and let's see. I'm going to share with you guys a link from Hawaii Office of Youth and Young Adult Ministry. And you guys can take a look at kind of how that covers the different aspects of it. Okay, so let me see if I can switch out my screen so I can share that. Here we go. There. Okay. So if you guys see here, this is the Diocese of Honolulu, right? It has section in youth and young adult ministry. These are all the resources right here, right? So you can click on resources. You can find out a lot of different things about that. So here's a young adult ministry section. Here's the main office. So right here, you guys will see the liability forms, right? Before, they had a photograph and video consent form. If I open that, let's see, are you guys able to see that? There we go, right? It was just a simple photograph and video consent form. It says what's going to happen, use photographs and videos for flyers, parish, etc. for the ministry, right? Consent from the parent and guardian is required. And they, right here, I authorize to give full consent. Right here is full consent, right? And then stating there's not going to be compensation. So here, this is just a consent form. In the Diocese of Honolulu, they didn't think that it's necessary to write a waiver or release. It just has the consent. But at minimum, you should have a consent. Now, let's take a look at what happened after COVID started. Now they have a digital ministry and photo consent form. So here, I don't know if you guys are able to go in there. Let me see if I can link that to you. I'll link that in the chat. Okay. Here, I sent that in the chat. If you guys go ahead and click on that link there, you guys will see the consent form. And I'm going to try to share that right now. Here we go. Okay, you see this digital ministry and photo consent form. It has the name of the school, name of the child, father or mother's name, right? They grant permission for the daughter or son to participate in the program. It says you have to name the program.
Charles.
Yeah.
We actually can't see it. Well, I can't see it anyway. The black screen.
You can't see it. Let me try that again.
Try selecting just screen 1 or 2, whichever one it is. Yeah, that's better.
Okay, you guys can see it now?
Yeah.
Okay, yeah. So see, I grant permission for my son or daughter to participate and receive text messages, etc. And then parents will always receive the same online meeting notification via text message or email, right? And then here's the photo and video consent section. And then on the next page, you guys will see, this is that section about virtual programming, right? It talks about how you can use Facebook, Instagram, Twitter, or YouTube or Zoom. And then it gives the section where I give permission for my child to participate. And they have this template where all you need to do, the chapter just needs to go and take this and edit the sections in red, and that's it. And so that's very simple and straightforward. If your diocese does not have something like that, go ahead and contact them and see what they do offer. Okay, if they don't have it, then you can just follow the strictest guideline based on your typical state or local ordinances. Okay. So let's go ahead and switch back to the PowerPoint here. All right. So we know about what the theory about liability. We know about what paperwork or virtual paperwork we need to do. Now let's talk about when we actually run the activities. So you need to remember the ratios still remain the same. You cannot have just one Huinjun running a Zoom session with a bunch of kakam, right? You need to have that minimum 2-person ratio, 2-to-1 ratio, at least 2 adults in the room to any number of children there. Never less than 2 adults, okay? So at least 2 Huinjun or 1 Huinjun and 1 Hipsi. And also here's another thing to keep in mind, Hipsi, Jingtan are not technically considered a valid chaperone. Huinjun are, And so if you do have, but they can be an adult, right? So you can consider one Hunjing and one Hipsi Jingtan, but not two Hipsi Jingtan in a room. Technically, you do need to have at least one Hunjing and one other adult. If you have breakout rooms, for example, you Sinhua Tongnan, and then you want to Jia Tanbado, right? And each breakout room has one team. Each team or breakout room must have at least 2 adults there as well. So that means for a session in which you want breakout sessions, you do need 6 Hunjing total, minimum of 6 Hunjing. Secondly, you want to make sure you record the sessions if it's like a Zoom or Microsoft Teams. It's not because you want to record that and say that, oh, a lot of parents might think, oh, but I'm going to record it and my child's going to be saved, for future use. That's not the reason why. You're not using this so that you can like creep up on kids. It's for you to review later on so that in the event something happened, a kid got bullied or a Hunjing says something that was, controversial, you as a Donjung or as another Hunjing Don, you can participate in the review process or auditing, and you look at that video and you're like, wait, what really happened, right? So it's more to protect yourself and protect the kids. Or Mo Am says that I've been, this one kid was being mean to me in the breakout room, right? You can identify the bullying that happens because just because they're not in person, kids are still mean to each other, they still bully each other. We still need to be aware of that, and we need to make sure we provide as safe an environment as possible. Okay, so recording the sessions help with that. Next is muting participants, right? Make sure that they are all muted, especially only to start off, right? And then allowing them to come in depending on the type of activity. But starting off with all muted is always the best so that you can get your point across first. And then taking attendance is also key. We do understand that not everyone can participate in every session. However, attendance has 2 things. First off, the liability side of it is that you know who was there and who was not. Secondly, if you take attendance, it helps promote this idea that people want to come because they're like, oh, I'm getting credit for coming, right? And in having an incentivized system, it gives a reward for people who do participate. And you can also track how people are participating. For example, Amanda comes in one day and then Jonathan comes in another day, right? And then you take a look at how often they go. You see, oh, Amanda seems to come every time we have a Sinhua, but Jonathan only comes whenever we have adoration. And then his friends only come at that time too. So you can take all that data later on and you can assess what worked and what didn't. Because we have to admit, this is going to be a trial year for virtual Sinhua. But the most important thing is use this opportunity to understand what's going on, to get that data, to collect that data, and then use that to revamp a better system for next year or for next semester. Okay. At the end of the day, like I said before, the main recommendation for virtual activities is always plan one. Okay, so this next slide in bold, as you see, prepare a plan for virtual Sinhua, even if your chapter is allowed to have in-person gatherings. If your pastor or Jia say, no, we don't want to do virtual, of course, Jia does have the final say. Do explain to him why it's important to come up with a backup plan, because it's not a matter of, like I said, if, but it's a matter of when. Just because right now, like I think Virginia allows up to 300 something people in mass, right? There's going to come a time when it's going to stop, and cases are going to rise, and people are going to have to cut things short. And we don't want things to happen like it happened in March, where all of a sudden we're scrambling and figuring out what to do, and everyone just loses communication. We want to have a plan in place. Okay? Any questions so far about this section? Okay. All right. And so let's go ahead and now migrate from the virtual programming and talk more about some of the in-person gatherings. I know this is not really going to apply a lot to California, but eventually when things get better, we will have more in-person gatherings. But I do know people are still trying to do in-person gatherings regardless. So let's take a look at what exactly we do need to cover. Okay. So this next slide here is the guiding principles for gatherings. I want everyone to go ahead and take a look at this link here from the CDC on this next page. It's the guidelines for community events, or large gatherings, large events. And the corollary to that is also the guidelines for schools. If you click on either one of those links, I'm going to send both of it. I put that in the chat. The first one is there, and now I'm going to send that second one. These are the 2 links. Essentially, they cover these 4 main principles. Okay, go ahead and take a look at, you can follow along using the link, because I'm just going to walk through the next few slides are going to be based on those links. So the first thing is promote healthy behaviors. Second is maintain healthy environments. Third is maintain healthy operations. And fourth is preparing for when someone gets sick. I know you guys can read all this on your own, so I'm not going to talk too much about each one of these. I'm not going to go, ad verbatim about all these principles, but I'm going to focus on a couple of important points from each one. So let's go into that first section, the promote healthy behaviors, right? What does this mean? This means that people are going to come and we want to remind them, because we're all human and we all forget, or sometimes we're just stubborn. We need to remember to practice the most healthy behaviors possible for every individual, especially who get excited about things and they forget that if there are symptoms or if you've been exposed or confirmed positive testing, you need to stay home, right? Make that a priority to emphasize. Hand hygiene, masks, we understand all of that already. But the main thing I think that we're going to encounter a problem with is adequate supplies. So when you decide to have in-person gatherings like Sinhua throughout the year, you do need to make sure you have ample supplies of masks, of disinfectant cleaning material, gloves, trash cans, wastebasket liners, things like that. You need to make sure that if you have a gathering, that people do have access to paper towels, to hand sanitizer, anything that's needed to make sure that they are able to practice these healthy behaviors. So that's the main thing I want to focus on there. How you obtain the funding for that, it's a little tricky, right? You can, if your Don is able to do that, provide that from the Don budget. If the parish is able to do that, I know a lot of parishes are suffering right now too, so it's kind of hard. But what I would encourage is ask for everyone to contribute, so that if the parents, the families of the children are going to go, maybe have everyone say, hey, can each family, if they come, able to donate, one set of masks or one bottle of disinfectant or whatever it is, right? So we have this whole community contribution, kind of like the 5 loaves story, right? When Jesus was preaching among the thousands. So you just have everyone contribute a little bit, then we don't need to worry too much about the funding, because I know that's a huge thorn in the side of everyone's pocketbooks right now. So the next thing is maintain healthy environments. Cleaning and disinfecting, we understand all of that, but the next thing is modified layouts. So we know how we usually go in doi and jauka and all that thing. You have like everyone standing right next to each other with arms length away. Arms length away is about 3 feet or 1 meter, right? We have to be 2 arms lengths away. So we obviously cannot do nimtap in the traditional sense. We need to make sure that when we nimtap hop các em, they understand that they need to assemble with that distance in mind, right? Maybe arrange the room in such a way with guides and physical barriers where you have like tape markings on the ground so that they know exactly where to stand when they hop. So you guys, I think if you go to like the post office, you'll see a lot of times you have these like blue tape lined on the bottom, right? Or just signs saying stand right here, wait right here. And then 6 feet away, there's another one. So if you have a hall that you normally use, go ahead and stick that down there. Talk to your the other people in your parish, right? Talk to your pastor and figure out who else uses the facilities. At the end of the day, if people use the facilities, they will want to have those markings as well. So you can go ahead and lay those out and help with that effort. In terms of healthy operations, one new idea that a lot of people aren't aware of, or that's kind of more novel now, is this idea of cohorting and rotated attendance. So let's talk about the rotated or staggered attendance first. I think that's pretty straightforward. If you guys can see how mỗi tuần mình có sinh hoạt là mình có 4 ngày, phải không? Ấu thiếu nghĩa và hiện. We don't necessarily have to have sinh hoạt every single week. Maybe we can spread that apart, maybe every other week. We also don't have to have it for the full duration. For example, đoàn viên Slim in San Jose thường là sinh hoạt 2 tiếng đồng hồ từ 4 giờ tới 6 giờ, right? And 1 hour of a sinh hoạt is probably too much at this point. We want to reduce the duration of time. So let's do 1 hour. But then maybe the first hour, 4 giờ tới 5 giờ, mình có thể cho ngành ấu sinh hoạt. And then 5 giờ tới 6 giờ cho ngành thiếu sinh hoạt. So that's staggered attendance, right? Or rotating attendance. And then the following week, you have nghĩa and hiệp. And then the next week again, ấu and thiếu. So just switching back and forth like that. That's called staggered and rotated attendance. Also, cohorting means keeping the same people together, or pods, right? I think in preschools and in daycare, childcare centers, they have, if you have these 12 kids, that child caretaker is going to be with those 12 kids only. They're not going to switch out another group. So right now, thiếu nhi is arranged in such a good way. We have cấp, and a lot of cấp, nhiều khi cũng không có tới mười mấy đứa, phải không? Right? Or các đội, right? You can send out by đội. And when you do that, it's very small groups. So you can limit the number of people in a group that you send out at a time. So you can maybe say, okay, only cấp 1 will send 5 this week. Next week is going to be only cấp 2. And then only cấp 1 chỉ có anh chị huynh trưởng này sẽ sinh hoạt với các em. So that way, if they just stay with each other, any kind of infection that does happen, it only stays limited to that group. Okay. That's the main thing I want to focus there on the healthy operations. And then the next one is preparing for when someone gets sick. Notifying health officials and close contacts. It is imperative that if someone does get sick, or they were sick and then they still decide to come to Xinhua anyway, and then you find out, you as an organizer do have an obligation to notify health officials. Usually that would be your county public health official, but it can vary in the district that you're at or the locality, but make sure that you do notify. And it's better to be completely upfront about it, right? You do need to inform everybody that that people have been exposed, or, you know, let's say someone chose not to wear a mask and they started coughing everywhere. You know, things happen, accidents happen, but it's important to make sure you figure out who that line of communication is to, and get those numbers on file so that you can contact right away. Because again, it's not a matter of if, but it's a matter of when it's going to happen. Okay, so we have, those are the 4 main principles you must consider as you plan for in-person gatherings. Am I able to promote healthy behaviors? Is the environment a good environment for people to be in so that it's socially distanced? The way I run things, the operations, is that conducive to social distancing? And lastly, am I preparing for emergencies or bad situations? Questions about those?
I have a question.
Okay.
But I can't type it on the chat. So can you go back a slide? Sorry. Okay, so you mentioned that if somebody gets sick that you should tell people about it, but there's also HIPAA regulations, so how does that fit in?
Okay, so HIPAA regulations, technically HIPAA is an Insurance Portability and Accountability Act. And so this refers to payments. So HIPAA, for anyone who isn't familiar with healthcare, is a law that came out saying that if you are a healthcare provider, and a healthcare provider specifically means an entity that basically takes money in order to treat somebody, then you are not allowed to share personal information. So how do you approach this? This actually does not violate HIPAA when you say that somebody is sick, right? This, because you as a don are not treating anybody. So telling people that we have somebody who is sick is not a violation of HIPAA. However, there is that sensitivity issue, right? We don't want to say that, oh, get someone, you know, maybe they were really shy, and then, you know, maybe an accident happened, and now that they know they're sick, and everyone in all their peers know that they're sick, and they're going to be upset about that, and that kid will not have friends again. You know, it's a really big emotional impact on a child. So you want to be sensitive about that. You do want to say that there has been a situation. You want that. I cannot say exactly how to approach that. It's going to be a case-by-case basis, but you do need to inform that there has been an individual in Don during the Xinhua that was exposed. You don't need to say who, but because you're cohorting, because you already have a scheduled attendance being taken, you already have clear, you know, systems in place for social distancing, that you do say this is the time and place in which that they were involved in, and anyone who was involved at that time and at that place should now self-quarantine. But at the end of the day, I think the main issue you're concerned about is HIPAA, and no, it does not violate HIPAA. Does that answer your question, Amanda?
Yes, thank you.
Other questions regarding that? Okay. All right, so let's go ahead and just do a quick summary here, right? As you saw, I listed objectives at the very beginning, and hopefully you guys can take a look and see, did you complete all of that? So the first objective was recall the main ways in which SARS-CoV-2, the name of the virus, is transmitted. how do you facilitate that transmission? How do you prevent that? So we know that SARS-CoV-2 mostly spreads by droplets from the mouth and the nose, right? And the way to prevent that is that we need to wear masks, avoid crowds and gatherings as much as possible. We already are aware of hand washing. I think that doesn't need to be said. But the new thing that we do now is wear masks and avoid crowds and gatherings as much as possible. Second objective was, let's identify the pertinent COVID-19 guidelines. We know there's so many different ones, right? So it's our responsibility to be familiar with them and stay up to date and follow the strictest combination. So like I said, California allows outdoors and indoors up to a certain capacity, but right now Santa Clara County only allows up to 60, Diocese allows up to 25, the strictest is 25. So therefore, for masks specifically, you can only have up to 25 people. For outdoor gatherings, you can't have 60 if it's a non-mask gathering, if the diocese allows that. So research your diocese guidelines and research your state and your local county guidelines for that. And if you guys need help with that, I'm more than happy to, help walk you guys through that. I've looked at too many guidelines in the past, 5 months now, right? And so I think I can take a look at that. And, if you're confused about what it is, feel free to ping me and I will help you take a look at it. Third objective was list tasks to prepare for virtual and hybrid activities. So the main thing we know, registration paperwork does need to have the consent and waiver forms. That covers the social media aspect as well as the activity. And then lastly, discuss the guiding principles for gatherings. So we talked about those 4 principles. Be able to go back to your dorm, talk to your fellow Winju, and figure out this decision-making process. Is this something that's essential? If it is something that is essential that I cannot cancel, can I do it outdoors? If I can't do it outdoors, can I do it virtually? If I can't do either that, if I have to do it indoors, in person, then what measures should I take? Markings or staggered attendance or cohorting, etc. Can I do in order to make it safer? Right. So have that decision-making process in place. This is something that should be discussed within your chapter leadership, and I say not just các anh chị ngành trưởng và ban chấp hành, nhưng mà involve your huynh trưởng right now, right? Your ngành should have a meeting. Your ngành trưởng should have a meeting with all your huynh trưởng in ngành and say, hey, we are taking care of ngành thiếu. What is the best thing for ngành thiếu, right? Your ban chấp hành đoàn cannot possibly cover all bases. So have focus groups, have your ngành groups figure that out in that decision-making process. Your ban chấp hành can make the overall decision on larger on events, right? But at the sinh hoạt level, the week-to-week sinh hoạt level, have that decision-making process with your fellow Hunjin. Involve them in the decision-making process so that they can be more invested and understand what's going on. Okay. All right, any questions about any topics in here that I've covered or anything that I may not have covered or COVID-19 in general? I am all ears at this point.
Feel free to unmute yourself. Apparently chat is not working.
Okay, seeing none. If you guys do have questions later on, go ahead and fill out that form that and Hugh sent out in the emails. And you can always ask that and I can respond to that later. And you can always contact me by email as well. Oh, I see something here. Okay. Thank you for coming, Michelle. Thank you, everyone. Okay, bây giờ chúng ta sẽ có một lời nguyện kết thúc nha. So today is the solemnity of the Assumption of Mary. It is not a holy day of obligation because it does fall one day before Sunday. But for those of us who have been able to attend Mass, that's great. If not, let's just remember that Mary is assumed into heaven with everyone else, with Jesus and with all the saints, and that's how she is now the Queen. And through her intercession, she will help us through this COVID pandemic. Let us offer together một kinh kính mừng cho Đức Mẹ Nhân Cha và Con Thánh Thần. Amen. Kính mừng Maria, để phúc Đức Chúa Trời ở cùng bà có phúc là hơn mọi người nữ, mà Giêsu con lòng bà gồm phúc là. Thánh Maria, Đức Mẹ Chúa Trời, của cho chúng con là kẻ có tội khi nay và trong giờ lâm tử. Amen. Dear God, please bless all of us as we move forward in planning for our academic year this year. In light of the COVID-19 pandemic, let us have the strength to be able to make the decisions that are very difficult, making sure that we are keeping aware and mindful of all the families that are suffering right now, catering to the needs of our children, their parents, our Wunju, being able to attune them with your will, with your plan for us, that we may see this as a growth opportunity and as a way to grow closer to you. In Christ we pray. Amen. Okay, thank you everyone for coming.